This is Srinivas. Today we are going to see about vaccines. So in that, first we will see about national immunization schedule. At the time of birth, so at the time of birth, the neonate have to take three types of vaccines. That is, one is oral polio vaccine, that is bivalent oral polio vaccine, and second one is BCG, Bacillus calamity guerin. Then hepatitis B vaccine, so at the time of birth the neonate should take three vaccines, that is to be remembered like Bob. What is Bob? Bacillus calamity guerin, BCG, oral polio vaccine, that is bivalent form, and hepatitis B vaccine, that is Bob. So except these three vaccines which are coming under national immunization schedule, another one medicine also taken by the neonate at the time of birth which is not included in this national immunization schedule, that is at the time of birth there is a vitamin K injection also will be taken by the neonate. So let us discuss about all these three detailing. Vitamin K. So vitamin K should be injected intramuscularly in the IM route. So this is vitamin K prophylaxis. Why this vitamin K is given? Why this vitamin K is given means to prevent the vitamin K dependent bleeding disorders, vitamin K deficiency bleeding disorders, that is VKBD, vitamin K deficiency bleeding disorders. So this is especially given for preterm babies as well as low birth weight babies. Low birth weight, preterm means less than 28 weeks. Low birth weight means less than 2.5 kilogram, and also for very low birth weight babies, that is less than 1.5 kilogram. So how much vitamin K you should give as an injection? In the anterolateral aspect of thigh you should inject this vitamin K. So how much injection you should give? If this neonate, this newborn is more than 1 kg, you should give 1 mg vitamin K. If neonate is less than 1 kg, you should give 0.5 mg vitamin K. So what are the vitamin K actually helps in synthesizing for clotting factors. So it prevents the vitamin K deficiency bleeding disorders. So what are the clotting factors dependent on vitamin K? Come on. Yes, 2, 7 and 9 and 10. Then come to at birth, what are the vaccines that we put that is named under National Immunization Schedule? Yes, come on. That is Bob. BCG, oral polio vaccine, then hepatitis B. So, oral polio vaccine. So, oral polio vaccine is known as zeroth dose. So, it should be given within 15 days of birth. So, why it is known as bivalent? Why it is known as bivalent oral polio vaccine? Because there are 3 types of strains of oral polio vaccine actually. There is P1, P2 and P3. So this P2 type of oral polio vaccine, this type 2 polio virus is already eradicated globally since 1999. So we only also it is a wild polio vaccine actually. So it also causes vaccine induced polio. So we should not give this strain. We only using bivalent, that is P1 and P3. So in oral polio vaccine we have what strain? That is Sabin strain, right? Sabin strain is a live attenuated vaccine. Right? In BCG, that is Bacillus calamity guerin. So how much this is given at birth? It can be given up to 1 year. Up to 1 year this can be given. If you are giving this at birth or up to 1 month, you should give only 0.05 ml of BCG. If you are giving this to a neonate, that is the age between 1 month to 1 year, you can give 0.1 ml of BCG. So oral polio vaccine is given by 2 drops oral route. This BCG is given intradermally on your left deltoid. All we have scars over there on that left deltoid because of this BCG intradermally. So actually this BCG is a freeze dried powdered form. It will be in this freeze dried powdered form. So you should add a diluent. What is the diluent used in BCG? Yes, please. It is a normal saline. Very good, doctors. So this is NaCl. So this BCG has no preservations. It has no preservations. So it should be after dilution, that is after reconstitution. After dilution, you should use this within 4 hours. If you use this after 4 hours, what will happen? It may lead to bacterial contamination. It may lead to bacterial contamination. So this leads to toxic shock syndrome. So this BCG is what type of vaccine? It is a live attenuated vaccine of Mycobacterium bovis. So it will prevent TB and other mycobacterial infection caused by Mycobacterium bovis. So it has no protection mechanism. It has no protection mechanism against the pulmonary TB. But it has a protective mechanism, protection against severe forms of childhood TB, that is extrapulmonary TB, meningitis, extrapulmonary TB, and meningitis, and miliary TB, etc. So if this BCG is injected by intradermal route, right? So if does not actually this BCG in intradermal route, it should heal. So what is the sequence of healing? What is the sequence of healing? That is pus, papule formation, ulcer, then scar formation. Papule is formed in 4 to 6 weeks, ulcer 6 to 8 weeks, scar 8 to 12 weeks. After 12 weeks, if there is no scar, after 12 weeks, if there is no scar, then it is an incorrect technique. So do not repeat the vaccine again. Do not repeat the vaccine again. Do Montauk's test after 12 weeks if there is no scar. Right? Then we are going to talk about hepatitis B. Right? Hepatitis B, how it is injected and how many doses and within how many time we have to inject it as doctors. Hepatitis B should be injected intramuscularly on left thigh. So left anterolateral aspect of thigh. So how much ml? That is 0.5 ml. Within 24 hours you should inject this hepatitis B vaccine. So whatever we have learned today what are the vaccines and what are the medicine that is given to the neonate at the time of the birth. So we have seen about in national immunization schedule at the time of the birth they have given oral polio vaccine, bivalent oral polio vaccine, Bacillus calmette-guerin vaccine and hepatitis B vaccine, and also vitamin K is also injected at the time of birth. So intramuscularly. What is prophylaxis? Prophylaxis means it is not only given for the babies who are in the deficiency of vitamin K. It is given to everyone to prevent the vitamin K bleeding disorder. So it is given to all the neonates who are born. So if it is deficiency or not deficiency, that we don't know, we just give it. That is prophylaxis actually. Vitamin K deficiency bleeding disorders, it must have to give to preterm babies, low birth weight babies, very low birth weight babies. And how much dose you should give this vitamin K, we have learnt it. Then we have learnt about bivalent oral polio vaccine. What is a dose, within how many days you should give, what is the strains that we are giving. In IPV, which strain is used? IPV, yes, it is a SOX strain. Then we should know about BCG. In what way we should use intradermally given vaccine is only two. One is BCG, another one is Japanese encephalitis vaccine. Only two vaccine given intradermally actually. Japanese encephalitis vaccine, right? Then what is the diluent added here? Normal saline. No preservative, so you should use this BCG within 4 hours. Then also we have seen about scar formation within 12 weeks in BCG vaccine intradermal route. Then we have studied about hepatitis B intramuscular route vaccine, how we should make it. Thank you for watching. This is the vaccine given at the time of birth, and also vitamin K is given, which is not coming under national immunization schedule, right? Thank you.